Thank you for joining me on this video today. My name is Susan Prather, and I'm a board-certified family nurse practitioner who is also board-certified in anti-aging and restorative medicine. I'm also currently enrolled in an integrative medicine master's through George Washington University. I wanted to take a minute amongst all of the chaos and fear that COVID-19 has brought us to bring you some information, hope, and action steps to help you fight back. First, I want to give you a few facts about the statistics of the virus. These facts are meant to inform, not to cause fear. Scientists predict COVID will infect 40 to 70% of our population. That's more than 150 million Americans. Today, 80% have mild or no effects, 20% require hospitalization, and 5% need intensive care. Mortality rates differ depending on the population, but in elderly patients with chronic disease, the rates range from 0.6 to 15%. Only 12% of Americans are actually metabolically stable. 75% of us are overweight, and 42% are obese. And 1 in 2 Americans has diabetes or prediabetes. Many with chronic diseases such as diabetes, heart disease, or cancer, which affects about 6 out of 10 Americans, are at the greatest risk with a 5 to 10-fold mortality rate over healthy COVID patients. The chance of mortality is about 3 times greater for patients who are obese. In up to 40% of the hospitalizations in 20 to 54-year-old patients, they were obese or overweight, and as many as 25% of people may be infected with no symptoms. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet through respiratory droplets produced in an infected person when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic or the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring, but this is not thought to be the main way that the virus spreads. What about spread from contact with contaminated surfaces or objects? It may be possible that a person can get COVID by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. How easily a virus spreads from person to person can vary. The number of people we can expect to be infected is an ever-changing number. The reality is that for now, this virus is a risk to us. We cannot control the virus. We can, however, control our own health. Optimizing our own health will ensure that if we get the virus, it will be a mild case. So how do we optimize our own health? There are several ways that I want to discuss. The first is eat to boost your immunity. First and foremost, our nutritional intake is one of the most important factors that we actually have control over. Eat real whole foods. Avoid processed foods as they suppress immunity. It is also a known fact that sugar causes inflammation and weakens the immune system. If you have struggled with sugar addiction your whole life and have never been able to kick the habit, now's the time. Let this virus be your motivator. For women, we should limit our sugar intake to 25 grams a day, and for men, 37.5 grams a day. These are the actual recommended daily allowances. Now is not the time to indulge yourself because you're home in self-isolation. High-quality protein intake is also helpful in boosting immunity. Make sure that each of your meals and snacks include high-quality protein. Aim for approximately 1 gram per kilogram, or about half of your body weight in grams of protein a day, or about 2 to 4 ounces or servings of organic, clean protein. Phytonutrients are also important in boosting immunity. Make sure to include citrus fruits and green veggies as these are high in vitamin C. Make sure you're getting enough vitamin A in foods like cage-free eggs and fish such as salmon. Probiotics are also known to boost immunity. If you don't take a daily probiotic, you should, because 60% of our immune system is in our gut. You should also add in some fermented foods that help maintain your healthy gut microbiome. What about immune-boosting lifestyle interventions? Now's the time to double down on optimizing our health. Now is the time to reestablish new habits that can be carried into a post-corona world. If you do not make lifestyle changes, all of your other efforts to boost your immune system and avoid the virus will be handicapped. So the first thing you should do is decrease stress. Increased levels of stress increase your susceptibility to viral infections. So use things like prayer, deep breathing, meditation, hot baths to improve your stress. We also offer alpha stim treatments that are FDA approved to treat depression, anxiety, and insomnia. And also an at-home option is to use HemiSync technology to help limit stress and help with sleep. Because without adequate sleep, optimal immune function is next to impossible. Get in a better rhythm and head to bed earlier. Aim for 7 to 8 hours a night. Balanced exercise is also key. If you over-exercise, you put extra stress on your immune system. The recommendation is 60 minutes of activity 5 to 7 days a week. Take this time to go outside, walk, run, or bike. Social distancing is poorly termed. It should be physical distancing. We are relational by nature, and removing connection can be detrimental. So make sure to use this time to catch up with old friends and family through virtual methods such as Zoom, FaceTime, Snapchat, and Marco Polo. Don't miss out on connection because you cannot leave your home. Stream local church services can also be helpful. If your church is not streaming, FBC Cleveland is. Check them out on YouTube. Start incorporating immune-supporting nutrients, a multivitamin and a mineral, vitamin C, usually 1,000 to 2,000 milligrams a day, vitamin D, 1,000 to 4,000 units a day, zinc, 20 milligrams a day, quercetin or quercetin in nettles, melatonin, and probiotics. Other enhanced immune supports would be N-acetylcysteine, which would be 600 milligrams twice a day, and alpha-lipoic acid, 100 milligrams twice a day. Herbal therapies for immune support: curcumin, andrographis, elderberry, astragalus, mushroom extracts such as reishi, shiitake, and cordyceps. Most of these nutrients are available at the Way Clinic or through our online dispensary. What about high-dose vitamin C IVs? High-dose IV vitamin C has been shown to boost immunity in several studies. In Wuhan, physicians used high doses of intravenous vitamin C for the sick and hospitalized. Almost all symptomatic patients receive 50 to 100 milligrams per kilogram per day for moderate symptoms and 100 to 200 milligrams per kilogram per day for severe cases. Many U.S. hospitals use intravenous vitamin C in the ICU now. We offer high-dose vitamin C in our clinic after a nutritional evaluation and lab studies have been done. When should you seek medical attention? If you have fever, cough, or shortness of breath, these symptoms may take anywhere from 2 to 14 days after you've been exposed, based on your incubation period, to present themselves. If you develop emergency warning signs for COVID, get medical attention immediately. Emergency warning signs include, but are not limited to, trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. This list is not all-inclusive. What should you do if you are sick? Stay home, except to get medical care. Separate yourself from other people in your home. This is known as a home isolation. Call ahead before visiting your provider. If you are sick or caring for others, wear a face mask. During a public health emergency such as this, face masks may be reserved for healthcare workers only, and you may need to improvise a face mask using a scarf or a bandana. Cover your coughs and sneezes. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water are the best option, especially if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid sharing personal household items such as dishes, drinking glasses, cups, eating utensils, or towels, or bedding with other people in your home. Clean all high-touch surface areas every day, including phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, and bedside tables. Clean high-touch surface areas in your isolation area or your sick room and bathroom every day, and let a caregiver clean and disinfect the other high-touch surface areas of the home. At the Way Clinic, we want you to be fully equipped to fight this virus if you were to be exposed. We offer many services here that will help you support your own optimal wellness during this time. Visit our website at thewayclinic.com or call us at 662-545-4599 to schedule an appointment. And don't forget, we have been doing telemedicine visits since our first day. Stay well and stay safe. Thanks.